We look at, for example, cancer as an example. It's a multi-billion-dollar industry. Who's going to let that go? And Indigenous people are a multi-billion-dollar industry to drug companies and to whoever is interfacing with us. So if we keep ourselves dependent on those drugs or those programs and services, people are making money. And so I look at myself as, a walking dollar sign sometimes to people because of that. Who wants to give that up? Who wants to give that up? I'm Albert Beck, and I am a Red River Métis citizen. My homeland is the Red River settlements in Winnipeg, Manitoba, and I currently reside in Ottawa, Ontario. I come from Red River, which is a small community, Métis community in Manitoba. Somewhere in between me being born and in the hospital, I got scooped and was placed into foster care and then eventually adopted into a Ukrainian family. And I was raised in northern Manitoba, in the PA. Found out at a very early age that I was adopted and knew, this was in grade 1, I knew that I didn't belong and I needed to get home. So at a very early age, I was dealing immediately with an identity crisis. And of course, as I was growing up and maturing, I realized that, that I had a secret that I was gay. And had to work really hard to keep that secret. Aside from being bullied every day and dealing with violence at home, it came to a point where, I ran away from home and ended up sort of back in foster care. I ended up moving to the city, and there's where my life sort of took many different turns. I was fully into drinking and eventually moved away to another city and ended up contracting HIV at a very young age. And so my life really was a mess. Didn't know if I was Métis or I was First Nations. Most times I thought I was Italian, Portuguese. Like I was whoever I wanted to be, Spanish, like anybody that was dark skinned, I was that. Unless I was drinking and I just thought I was First Nations, and so I tell everybody it was First Nations. But those are the coping mechanisms. I lived in a very made up world because I didn't have a real world that I could begin. And a lot of us that are two-spirited have been ostracized from the church. And so there is a very strong religious tone in our communities that doesn't necessarily include two-spirit people in those spaces. I used to be ashamed of being two-spirit. I used to be very ashamed. I was actually initially identified as a gay man. Even being Métis was also stigmatized. So I was dealing with a lot of stigma. I'd be sitting in sharing circles, bawling my eyes out, pretty much for maybe 2 or 3 years, where I just couldn't figure out why was I crying so much? What was going on? And I was dealing with a lot of that, a lot of guilt, a lot of shame, having to tell your parents, having to go through all these things. And there wasn't a support system there for me. My experience with CAAN started when I was newly diagnosed. I was a member of the Manitoba Aboriginal AIDS Task Force. From that time onwards, I've served in different capacities on the board, IPHA caucus, and just different conferences and international meetings and other work that CAAN has taken on that I've been able to participate as, coming from a Red River Métis perspective and always bringing that voice to the places that I could advocate for my community. And eventually that connected me to the national organizations, CAAN, and then working in federal committees like the National Aboriginal Council on HIV and AIDS, NACHA, and other advisory committees that I've sat on over the years. That initial interaction led to me finding my home, finding my family. So HIV's given me a gift and has set the path for the work that I do today. I grew up in the European Eurocentric mindset, so coming from there and coming into the Indigenous communities and working in this space, I was able to see the effects of colonization, discrimination, stigmatization, and all these isms that we are dealing with as a community. We look at the mental, emotional, and the physical and the spiritual spaces. It was CAAN and the Aboriginal Aid Service organizations that sort of helped me figure out those pieces and bring those pieces together to make what we normally call a medicine wheel. And it was about the 4 medicines. It was about sharing circles. It was about sweat lodges. Those were the entry points in my life. I look at the 4 medicines as teachers that have really sort of been incorporated in my life. I have them in my home and I use them when I need them. Being a person on antiretrovirals, I don't see very much difference between the traditional medicines and the antiretrovirals because I'm asking those medicines to work together. You know, we talk about HIV as a messenger, as a spirit. I've always believed that HIV is a spirit and the messenger brings messages. We look at COVID-19, for example, and how important the message there was to actually, band together and support each other. And that lesson wasn't really learned. From that perspective, CAAN has sort of given me a broader understanding of what human kindness, human interaction, and human advocacy really is all about. I'm here to eradicate the illness, but then I also look at it that this is a messenger, that we're not listening to what the message this particular spirit is telling us to do. And that's to really support one another and to make space and to really, work together as humankind. HIV is a human immunodeficiency virus. It's human. It's about humans. The little virus is tricky. It hides and all these amazing things, and it wants to live just like we want to live, right? And so it's really hard to take something out that wants to really, really live. So there's that component or that piece to the virus, but also there's the social part of that. It eradicates stigmatization, discrimination, and all the other isms. We might have a fighting chance at really seeing this go away. But we're starting to see TB on the rise now, and we're seeing syphilis on the rise now. Part of the other reason why I think that it won't go away is that we get comfortable in our, we did a good job. We've got this all under control. We've got medications, and now we're complacent because we got the medications. And I remember early on in the epidemic, there was no sit back and wait for anything happens. We were on the asphalt, pounding the pavement, asking for action from the governments, etc. As soon as antiretrovirals came into place and these long-lasting antiretrovirals and all the other medications that are available, we've become complacent, and there is an issue around that as well, around, PrEP and those medications that actually could really sort of, put HIV at a much lower rate, but they're not being made available to Indigenous populations or those populations that really, really need it. If we can continue to keep doing the work that we're doing, which I believe is very, very underfunded or not even funded at all, I think ultimately we can see some changes, some shifts in how that looks in terms of ensuring clean water and housing and access to food and all these things that really are predeterminants to good wellness. Can't wait to see what that's going to look like in the future, how things are going to change, and things are changing under reconciliation and so forth. And reconciliation isn't necessarily about reconciling, it's about wrecking things and then putting things back together better. Take your time for yourself to heal. Take some time to go through your mourning process. You are going to be going through that process because the old you is no longer going to be that person. You are now a new person that's going to be living with HIV. It's a new world. Use your skills, use your gifts to be able to help others. And public service is a really key component to healing. you will know that you're ready to give back, you're ready to receive, you're ready to move forward. And when that day happens, that's when things are going to shift and change for you.